The Tennessee's nursing board took more than a year on average to discipline area nurses for stealing drugs. Nurses whose #1 job was to care for patients. It's community watchdog Nate Morabito's latest discovery into drug diversion disciplinary delays.
Sarah, we're talking about area nurses whose cases include publicly releasable documents. Our investigation previously found the disciplinary process can take so long that some nurses are able to keep their licenses, find new jobs, and put more patients at risk.
It's extremely important that we not have medical professionals that are impaired.
Having just went through a medical procedure of his own, Gene Perrin knows what it's like to put your life in someone else's hands.
These are professionals that we entrust our loved ones to be taken care of when they're in sometimes the most vulnerable parts of their lives.
The Sullivan County prosecutor also knows how long it can take the Tennessee Board of Nursing to suspend or revoke a nurse's license.
That offends me.
Despite the efforts of the Department of Health's investigators, people Perrin says work hard to build solid disciplinary cases.
My frustration has been you have that group of investigators that are working these cases up, many times hand in hand with our criminal investigators, our TBI agents, our office, and yet it hits some roadblock and it just sits there in this administrative bureaucratic mess.
A review of the last year's worth of drug diversion disciplinary action taken against nurses from our area revealed after the state first received complaints about nurses, on average it took nearly 400 days to take formal disciplinary action. In most cases, records showed that disciplinary action came long after the nurses either admitted to diverting drugs or tested positive after a drug test.
We actively seek ways that we can improve our processes, and we think it's important to be responsive to our customers.
The Department of Health previously told us it's made changes to try and minimize future delays.
This is really shocking to me.
Senator Rusty Crowe tells us the department and nursing board are still actively involved in conversations about other possible solutions.
We're going to have to find ways to make sure that those that are in that situation that are dealing with patients, we protect the patients. And at the same time protect the due process of a nurse or any practitioner while they're being investigated.
Perrin welcomes those conversations.
My first thought is it's long overdue.
He knows it's a problem, and not just on this end of the state.
We simply shared our frustrations, but we're not unique. We're not alone.
Senator Crowe previously scheduled a special Senate Health and Welfare Committee hearing for today to further address the issue. But he says he had to reschedule due to other lawmakers' calendars. That hearing is now expected to take place next month.
And the Department of Health previously told us discipline often takes longer when the people at the center of investigations deny wrongdoing. By law, the nursing board also has to try to and help rehabilitate nurses.